people often wonder about the discomfort of an in-office facelift compared to a general anesthesia facelift, and really it can be brought down to two different time frames. First is the numbing up. With an in-office procedure, there is about 5 minutes of numbing up, which can hurt some. And it's like going to the dentist, and having done lots of these, there are three groups of people that say that it hurts: men, nurses, and women who have not had children. And in that, I know that men typically are wimpier, having operated on lots of men, but it's the women who had kids, whether you've had children naturally or with C-section. I think raising kids just makes women tougher. And so women that have had children typically don't have any trouble tolerating 5 minutes of numbing up. Women who have not had kids typically say it doesn't feel very good, but really it's only 5 minutes, and we give you some Valium, and we've done gobs of these, and nobody has, that I can recall, has ever said that it was not worth those 5 minutes of numbing shots. There should be no pain during the procedure. When we get done, it just feels tight, and we put a pretty tight head wrap on you. And then there's a week of recovery, during which time you have to wear a head wrap. And that head wrap can be a pain in the neck, literally and figuratively. And so with the head wrap, the first night, it's very, very snug to hold everything into place. And we have you come back the next day and take that wrap off. And then it's just a fairly loose, fairly non-compressive head wrap, just to hold things snug, but it's not unduly tight. But the discomfort that people have is from the stitches that hold this neck muscle up here along the jawline to the bone behind the ear. And there's a nerve that lets you feel your ear that puts pressure on. And so the pain that people have for somewhere between 3 hours and 5 days is pain behind the ear. And typically my average female patient will take 2 pain pills the first night, and 1 the second day, and 1 the second night, and 1 the third day. And then after that, Tylenol does it. There are exceptions. I've had several weeks where patients didn't take any pain pills, and I've had several weeks where most patients took all 20 pain pills. But that's pretty average.